I think that's probably good enough for me.
Seamless continuity of care, enhanced communication, improved provider satisfaction, enriched patient experience. Those are the early returns from the Broder Service, a 3-month pilot program at Baystate Medical Center in Springfield, Massachusetts. Named in recognition of Baystate's former chair of the Department of Medicine, the unit-based multidisciplinary rounding approach to inpatient care is not unique to the field of hospital medicine, but it is making an immediate impact on the 32-bed Springfield 1 unit at Baystate. The service, which rotates 5 senior attendings, has 2 missions. It provides early career hospitalists with mentorship and a smooth transition as they navigate the complexities of the healthcare system. And it encourages a team-based environment where providers and caregivers not only have an equal voice in patient care, but also enhance the continuity of care. Dr. Greta Boynton of Sound Physicians and the chief of the hospital medicine program at Baystate is in her 2nd week as a Broder attending.
From my perspective, we've been able to impact things that are more process-oriented in care, making sure that we're all communicating the same message to the patients and the family, that we have a platform where we can all discuss the case together so that when you go back to the bedside, the patients are not getting mixed messages. The other thing that I think it's been really helpful for is smoothing out the care in a really complicated healthcare system. There's a lot of obstacles to move patients through to get testing done efficiently, or to communicate with the right consultant, or to arrange post-discharge follow-up or access to specialists. And when you are in a room where the care manager is there, the consultants are there, the hospitalists are all right there and can have those conversations, we can quickly escalate cases through the system in a more efficient way.
Broder Service already is making life as a new hospitalist easier on Dr. Eli McKenna-Weiss. He just finished his residency at Baystate and joined the hospitalist group in July. The Broder Service introduced him to the concept of geographic rounding, and with many of his cases complex in nature, being mere steps away from his patients makes a big difference.
What it also means, though, is I'm around a lot, and so I interact with the nurses frequently, whether professionally or personally, which I think builds trust and just it makes it easier to work. We work better together. They're less afraid to ask questions. I'm more able to give them real answers and to provide them help quickly so they can get on with their business as well.
The jewel of the Broder Service is midday multidisciplinary rounds, where providers, nurses, case managers, and subspecialists cram into a small conference room to examine patient issues.
But we need to know about the linazolid.
Dr. McKenna-Weiss says the 11 a.m. meeting serves as a forum for every care team member and makes for a more cohesive unit.
Came in with a DRG of 5.3.
That's a key element of multi-D rounds, adds nurse manager Debra Meyer.
The patients know that everybody's on the same page. They know what their plan for the day is. They know what their plan for the course of their stay is. And ultimately, we're able to very early on identify those barriers or challenges to getting them discharged or transitioning them to the next level of care, and we're able to proactively address those prior to discharge so that we can discharge them to the appropriate level at the appropriate time.
Amber Stetson, who has spent all 17 years of her nursing career on the Springfield 1 unit, says the Broder Service focuses on what needs to get done today, who needs to do what, and provides a new level of accountability.
I have a chance to see my patients, assess them, know what's going on, look into their chart a little bit more carefully before I go into rounds. So I feel even if it's my first day with the patient, I can actually contribute to what do I see from a nursing standpoint is the big hurdles to get over for the day. Yeah. And I can bring that to the team and we can all sit down and talk about it. So at 11 o'clock, just enough time to get to know the patient, but still enough time throughout the rest of the shift to get things moving, get things going, get things done.
You'll have to take those antibiotics for about another 5 days.
The nurses and staff on Springfield 1 are a tight-knit bunch, and they have to be. The census is focused on patients with acute respiratory and pulmonary conditions. Having routine interaction with unit-based hospitalists encourages collaboration and, according to Stetson, is a huge improvement.
Not only do we get to know them better and work better alongside of the hospitalist that's assigned to the floor each week, but they also get to know us and know how we work. We bounce ideas off of each other and what works, what didn't work. Hey, didn't we just try that? Yes, I remember that from a couple of days ago. It's like a working partnership.
That's exactly what Dr. Andy Artenstein, chair of the Department of Medicine, envisioned when he began forming the Broder pilot program. An idea he said was germinating for some time. The service is built upon the philosophy patient care can be delivered better.
It's a true integrated unit where nurses, doctors, case managers, social workers, pharmacists, respiratory therapists, you name it, consultants, are together talking about the cases as a group, getting everyone's input in an organized fashion, and talking to the patient in an organized fashion about what's going on with them on a day-by-day basis. And not only that, but what they're thinking about on day 1 will happen on day 2, 3, 4, and 5.
Broder Service is looking at a number of standard measures like length of stay, cost per case, and readmission, but also is taking a deeper dive into provider and staff satisfaction.
In terms of early results, while I don't have anything scientific or quantitative, what I do have are qualitative interviews I've done with a number of members of the staff. What I found is that to a person, people feel like this needs to be sustained.
Visit our website for more hospitalist-related video.